Recently switched from the traditional practice, said that working 12 to 14-hour days, he didn't get to spend a lot of time with his family, and that was really hard on him, obviously. Another reason is just the payment. There's an increasing number of underinsured and uninsured Americans in this country. The Medicare program is making cutbacks on how much they're going to pay. For example, there were 2 surgeries in the article, and I don't remember exactly what the numbers were, but it was like a $200 difference just within the past couple of years. And hospitals typically give privileges to their doctors rather than just handing them money for doing the surgery. Like one of them was listed letting them use their operating room, which I don't really think is much of a privilege when they have to be doing the surgery, but whatever. Another reason is they can't afford their medical bills, their medical school bills. There was a lady in there who just recently switched practices just within this last year, and she had cut her medical bills down by like $100,000. Some of the effects on the hospitals, it's obviously costing the hospitals a lot more money to hire these temporary surgeons. The U.S. healthcare system is one of the world's most costly healthcare systems in the world, and it accounts for nearly 17% of all of the U.S. economy. And these temporary surgeons cost the hospitals about $15,000 a day, and that's not, or $1,500 a day. That's not including like the hospital paying for them to get there and putting them in hotels either. There was one hospital in the article that had to hire 3 temporary anesthesiologists, and it cost them $1.2 million. And overall, it dropped their operating income for that year by $4 million.
Well, the general problem here is that there are potential safety risks. A new surgeon may not be familiar with the hospital staff or with surgical patients coming in for follow-up visits. The American College of Surgeons condemns the practice of itinerary surgery, where doctors operate on patients and leave follow-up care to a physician. This causes the high